I just learned about a new one this week. There's a new company out where people can get night guards that way too, where they send it. But I would be kind of a little questionable about that too, because you want to make sure how your bite is, too. And just, I think you just should always have an evaluation first, you know?
Exactly. Exactly. Yeah, for me, like when I think about dental, I'm from India, so when I think about dental, at least dental procedures in US is super expensive. So I go for tests here, but any procedures I get it done in India when I fly down to India, like it's a whole thing when I get it done. But yeah, probably I don't know which side of dentistry is more advanced or which side is right. I
Well,
just think of fast most of the
America's
time.
going to be more advanced mostly than India than what I have seen. Just they're not as on the periodontal health piece, right? As not, you know, that they're still more focusing on it whenever it hurts more in that culture. It's definitely more the culture that, and so because of that, that's kind of how they treat majority of things over there.
Yeah, in India, like I got used to the system of going to dentist every 6 months, 6 to 8 months, like after coming to US. In India, like you said exactly, I just go to dentist when it hurts. And that's what
Mhm.
my parents do till today.
Yeah. No, I know that because I worked with a doctor for a long time. Actually, it's one of my favorites.
Uh-huh.
And he's Indian, and a lot of his patients would come in and they would, be like, no, kind of like this, my gums bleed, yeah, but it's not hurting. Well, that's the thing about periodontal disease that people don't realize. It doesn't hurt until it's too late. Because with periodontal disease, it doesn't hurt until it's pretty close to time as we're losing that tooth and extracting it. Versus if we could have caught it early, then that would, we can maintain your teeth for years and years and years. Because we can stop the bone loss from occurring, clean those areas up and help you keep it clean at home. And then, you're good. And then even now we have great things like periodontal trays. My husband uses those, and he wears them just 15 minutes a day. And so after he brushes his teeth, he puts these in, and it's a hydrogen peroxide mixture, and it creates a pressure, kind of almost creates like a hyperbaric chamber, and it creates that environment when the peroxide goes into the sulcus, goes in around the teeth, and it creates this effect. And so what it does is it kills that bacteria every day. So really, long term, I think it's going to end up where everybody has that. Matter of fact, my friend called me last week, and she was like, "My mom's having surgery, and I'm worried about her periodontal health. I want to get her in some perio trays before she goes into surgery because she's having like a knee replacement." Right? And one of the bad things about a knee replacement is like it getting infected. And that same bacteria in the mouth goes through the body, and it's going to catch, the weakest point at that point. And so that's why she wanted to make sure that her mom had periodontal trays.
So talking to you, I feel like I'm reading a dental Wikipedia, right? You know so much about it. And the best part is you're super excited to talk about it and explain everything in detail. That's the best part.